Some people have so much pain when they're exercising on land that they just say, forget it, I'm not going to do it. Hippocrates used hydrotherapy, treat muscle spasm. You have to have some what we call true didactic learning, where you kind of sit in a classroom and learn. But we know that's not the best way to get all of the whole picture. Stay low, and as you're doing your straddle jog, make your hands like pancakes and push down in the water. The experience of what it's like to be in the water, using it in different ways, gives the physicians a window into what it's like for a patient to do that type of therapy. You can turn your hand and actually push the water and feel the difference with how much resistance you get.
A lot of these therapies are new to us. We write the prescriptions all day long, but actually seeing the different techniques and experiencing them is all new to us.
Now try and push underwater.
And so for us to get our hands on some of the flotation devices and some of the balancing techniques is really important.
So this gives you a little taste of what your patients can experience working in the water. You can use water to provide resistance to directions of movement and do different types of therapy for patients from very frail to professional athlete level exercise and training. So just a little knee-high march there.
It really helps us to be able to connect with our patients who are sometimes even skeptical of what we're prescribing and say, look, we experienced it, we know exactly what it is that we're prescribing here for you. So then they're ready to jump in the water and get started themselves.